Dr. Mesic's presentation, and I'm going to explain the best measurement models we can fit to our person-centered care index. In a way, we can ask, summing the items is the best way of summarizing the person-centered care index, or there might be some other type of models we can use, and we can get more information from our scale. And for this purpose, in my presentation, I'm going to explore the dimensional structure of the person-centered care index more, or you can say that whether unidimensional factor structure is better than multidimensional factor structure, or by factor structure is better than multidimensional factor structure. So we are going to test all these different type of measurement models, and we are going to see which one is fitting best to our data. And finally, we are going to give some preliminary data about the person-centered care index. And in the final section, I have an example to explain this type of measurement models in more detail in a different data set. As Dr. Mesic explained in his presentation, we have 8 broad categories and a total of 33 items. And holistic scope, for example, has only 2 items, but the rest of the scales goes from 3 to 9 items. And the data we collected, which is also limited data, collected from 3 centers from England, California, and India. Based on those individuals, when we summarize each assessment, each domain, the range of scores goes from 2 to 3, which means from frequently to always. And when we conducted a preliminary principal component analysis based on our limited data set, we saw that for this data set, unidimensional factor structure principal component analysis provides an indication of unidimensional factor structure, and cultural sensitivity has the lowest factor loadings, but the rest has reasonably high factor loadings. Based on that data set, somebody might say unidimensional factor structure might be fine and we can accept that. But as you know, this is a correlation type of method, so for a larger data set, we may not have this type of factor structure. So the numbers, factor loadings might be different. So for that reason, we cannot say for sure that our PCI index is unidimensional. So we are proposing different measurement models or different factors structural models. The most restrictive one, as you can see, is the unidimensional factor structure. We have 33 total items, and as you can see, the first 6 items are coming from ethical commitment, and PCI is in the circle. This is the overall factor structure, and all these 33 items are indicators of one latent factor. This is the most restrictive model, and we have some indication based on our restrictive sample that we might have unidimensional factor structure. The next model we might want to test other than unidimensional factor structure is the 8-factor solution. This is a multidimensional factor structure. Assumes that this is the simple multidimensional factor structure. Assumes that there are 8 subscales, and first 6 items creates the first, are the indicators of first factor, and the last 3 items are the indicators of last factor. As you can see, there are no correlations among those factors. This is a very simple multidimensional factor structure. And the next one is a little bit more complex. Looks like the 8-dimensional multivariate multidimensional structure. The only thing we added here are the correlations among those domains, 8 domains. So you might think that that's more realistic model, since all subscales might be correlated. And the model 4 is unique second-order factor structure, which is a little bit different than the multidimensional factor structure. Here we are, again, 6 dimensions, 8 dimensions, and those are clearly specified. We did it before. But those 8 dimensions are the indicators of overall second-order unidimensional factor structure. So person-centered care index are the second-order, higher-order factor, and scale 1 to scale 8 are the indicators of that higher dimension. And the last factor structure we are going to test is the bi-factor model, which has been used recently in many applications. And in a figure, it looks like this. Again, we have 8 dimensions, 8 specific dimensions. And for example, items from A1 to E6 are the indicators of scale number 1. And we have rest of the items can be specified similarly. But in addition to that, we have one general factor. That general factor is the person-centered care index. So all these 33 items are the indicators of general factor in a way that looks like the unidimensional factor structure, but in addition has a multidimensional factor structure. So it's the combination of 2 different factor structure in one model. So that's one factor we also want to test. And as I said, we have a very small sample, and that's why it's not reasonable to apply all these 5 models to our PCI data. But I'm going to show you one example using those 5 factors and compare them and pick the best fitting model using the substance use disorder diagnosis abuse symptoms. And those are the drug groups. We have 6 drug groups and total 24 abuse symptoms. Based on those 24 abuse symptoms, that's the description of the sample. It's coming from the center I work for, which is Center for Education and Drug Abuse Research. And first I tested for 539 individuals the unidimensional factor structure of the abuse items. And the first part is the marijuana abuse symptoms, first dimension. The last dimension is the abuse items for the stimulants. And we have total 24 abuse items. And the second model, uncorrelated multidimensional model, using this again 64 abuse items. And third model is, as you remember, the correlated factors. And the second higher order abuse factor is the fourth factor I tested. And the fifth model was the bifactor. So I summarize all these results in one table. And here we have 5 models, and here we have number of parameters estimated, and the final column is the column you want to take a look at. And this is the sample size adjusted Bayesian information criterion. And the smallest number shows the best fitting model. According to this criterion, 6-order multidimensional correlated factors gives us the best fitting model. So based on the Bayesian information criterion, this is the best fitting model to substance disorder abuse items. So we are going to test the same 5 models when we have the larger data sets for our person-centered care index. That will end my presentation.